Welcome to school age kids. Just like with all the other age groups, let's start with physical growth and development. So growth really hasn't changed much yet for this age group. We're still looking at about 2 to 3 inches per year and about 5 pounds per year for these kids. Slow, steady growth until they hit what we call the pre-pubescent growth spurt. And this is the growth spurt that happens right before the kids hit puberty, hence that word. We do know that girls are going to hit their prepubescent growth spurt before boys. So we usually see first, second, third grade. Most of the kids are approximately the same size. Then we get to about fourth, fifth grade, and suddenly all the girls are taller than all the boys. And then when we finally get into high school, then most of the boys have hit their max height and start to be taller than most of the girls. For motor skills, we've really hit all of the important milestones in both gross and fine motor, but what we start to see is improved coordination and balance and shortened reaction times. We also then see wider differences in basic ability. So while most kids will hit most milestones about the same in infancy and toddler age groups, here in the school age group, we see that some kids are better at the gross motor skills and will be the soccer players, the tap dancers, the football players, where other kids will be more into the fine motor. So we start to see the artists or the musicians. So those individual differences are more obvious in this age group. For cognitive function, we're still working with Piaget. And he says that these kids are in the concrete operational stage. So we've moved from pre-operations in our preschool age group into concrete operations. So think about the word concrete here. Most people think of cement, that hard stuff that you walk around on. But from a grammatical sense, this word concrete means something you can see or touch or feel. So a concrete noun would be something like table or flower, where an abstract noun is something like happiness or loyalty, something that's a little harder to explain. So our school age kids are okay with these concrete concepts and really not very good with these abstract concepts. Some new vocabulary words for you here. First of all, we have selective attention. I'm sure you all know what this is. You've seen it, you've experienced it yourself. This is where you're able to block out things you don't want to pay attention to and focus on the one thing you are trying to pay attention to. So sometimes kids do this on purpose when they accidentally don't hear their mother telling them to take out the trash. But really what we're talking about here is the kid's ability to sit in a classroom full of other children and actually focus on practicing their spelling words rather than talking to all the other children. So that is a skill that is learned a little bit older here. The preschoolers, the toddlers would not be able to do that. Next word. Automatization. This is where tasks become automatic. See that almost in there? So things like brushing your teeth or writing your name or tying your shoes that really required a lot of thought when you first learned them now become so automatic you don't even have to think about it anymore. You can probably remember this best if you think about learning to drive. When you first started, there was a lot going on and you really had to concentrate hard. But now when you drive around, you're probably thinking much more about all the other things you have to do today and that crazy thing that someone else said, and the driving part becomes automatic. Okay, 2 more vocab words for you here. Reciprocity and reversibility. These are 2 thought skills that show up in the school age stage. Reciprocity is just understanding that A plus B is the same thing as B plus A. You'll notice it's a very mathematical sort of theorem, and that's true of a lot of what Piaget was focused on, logic and math. And then reversibility is the opposite of that preschool idea that you're stuck. the school-age kids now understand that you can go back. So if you did the how much blue water is in each cup exercise with the school-age kid, then the school-age child can picture pouring the water from the tall, skinny cup back into the short, fat cup. And so they can reason that really there is the exact same amount of water in the two glasses, even if they're different shapes. Just to mention with Piaget here, he's very into math and science, basic logic. So this is one theory of cognition and one theory of intelligence, but you'll remember from your teaching and learning course that there are also theories of musical intelligence and kinesthetic intelligence, and Piaget really has nothing to say on that subject. So that is one of the limitations here. Okay, a big task for students in this age group is to learn classification. So how we see this manifested is that students in this age group like to create collections. I don't know how many of you had a rock collection or a Beanie Baby collection or a troll collection. Just anything that you can group by color, shape, size. These kids just love to collect it. It can kind of drive the parents crazy because they might have 15 collections going all at once, but it really is just to help them as they practice learning this new skill of classification. Okay, lastly, language. Language learning in this age group is now much more formalized. So students actually learn language arts in elementary school. They have spelling words, they have grammar classes, they learn vocabulary words. They're also learning metaphors and sarcasm and jokes. So language is becoming more of a fine art rather than just simply a communication tool. Because of all these new skills they're learning in language, a lot of kids will actually start to play with the language and develop their own secret languages or their own codes. So that can be a lot of fun to watch as well. Believe it or not, it actually takes until about 6 or 7 for most kids to truly understand the difference between tone versus content of what someone is saying. So saying to a kid, "Great job," makes sense at any age. But if you say, "Wow, that's the worst thing I've ever seen," the younger kids will still think it's positive simply because your tone of voice, where the older kids realize that there's a disconnect and that you're making fun of them. So not necessarily a fun skill to learn, but it is a valuable skill for these kids to learn. And then again, this is where jokes become funny. And the knock-knock jokes and the riddles are now really popular, and this is where kids will bring a book of jokes to school and they can just read jokes for hours on end because it's new and it's interesting to them to pick up on. And, you know, adults might not necessarily laugh at every joke the kids tell, but at least it's fun to fool around with. We're now going to step away from specifically school-age children to talk about a broader concept of ADHD. So you hopefully already know that this stands for attention, deficit, hyperactivity, disorder. We used to have 2 separate ones. We had ADD and then we had ADHD. When the DSM-5 came out, this went away and just became a subtype of ADHD. So everybody now has the ADHD diagnosis, and then you can have the inattentive type, the hyperactive type, or the combined type. So there are 3 core symptoms of ADHD, and in order to be diagnosed with ADHD, these symptoms need to be present both at home and at school. If they're present only in one situation, it looks more like a behavioral issue rather than true ADHD. Here are your 3 core symptoms. Number 1, inattention. Number 2, hyperactivity. And number 3, impulsivity. So inattention would be sitting in class and you're supposed to be learning about Mark Twain's book, Thomas Sawyer, but instead you're really busy thinking about the party you're going to have this weekend. To the point where students will not hear homework assignments, not hear directions. At home, kids will lose toys. They don't know where they left things. In adults, we'll see losing keys, losing cell phones. So you lose things, you forget things, you can't hear things because you're paying attention to something else instead. Number 2, hyperactivity is pretty straightforward. It's really hard for a hyperactive person to sit still. So in school, we see that the child is constantly getting up and moving around the room. We can also see it with speech, where someone may talk excessively and quickly. It almost sounds like pressured speech, like you might see in someone with bipolar disorder. Then number 3 there, impulsivity. This sort of relates to the hyperactivity, that the kids, if they have an impulse to do something, they can't repress that impulse. So an impulse to jump up out of their chair, why not? Let's do it. An impulse to interrupt the teacher while the teacher is talking, of course, why wouldn't you? So a lot of interrupting, a lot of strange behaviors that don't seem to make sense to other people. This can also lead to a lot of risk-taking behaviors in our adolescence. Speaking of risk-taking behaviors, we do know that people with ADHD do have a higher risk for depression and anxiety, for poor school performance, for injury or accident, and for substance abuse. So the poor school performance, the injury, the accident is related directly to the disease. The higher risk of substance abuse is usually self-medication. They learn that whatever the substance is helps them feel better, helps them do better, and so they continue to take that and abuse that and often end up in an addiction situation. There is also the issue of the addictive nature of ADHD medications, but we'll talk about that in a second when we talk specifically about the medications. For treatment of ADHD, we really do need a multidisciplinary approach. A lot of people think first and only of medications, but this is a multifaceted disorder and so needs a more holistic approach to treatment. So first we actually need to think about therapy for the family and specifically for the child. The child needs emotional support, self-esteem, some coping mechanisms, but the family in general has a pattern of the child misbehaves and the parents punish, the parents get angry. So with that pattern in place, it's really hard for the child to ever succeed at anything. So the family needs some help creating new patterns and breaking old habits. We also need to talk about school interventions. This can be simple things like putting the child towards the front of the classroom so there are fewer distractions, allowing the child to use an exercise ball as a chair or to have a rubber band across the bottom of their chair to provide for that constant need for movement, allowing the child to take quick breaks to run the attendance down to the principal's office or any of those small chores that a teacher can come up with in school. The child may also need some assistance with keeping a planner, organizing assignments so that they are not losing track of due dates. Most importantly at school, though, and at home, is physical activity. We do have a fair amount of research that demonstrates that with increased physical activity, symptoms and need for medication of ADHD are both decreased. So increase that activity and your need for meds goes down. Unfortunately, what we're seeing at a lot of schools is that they are actually decreasing the amount of recess that children have each day. So that is really especially hurting those students with ADHD, although it's not particularly great for any of the students in that school building. Okay, finally, we do need meds. They can be very helpful if used appropriately and in the right situations. So the most common course of medications are your stimulants. This includes medications like the amphetamines, methamphetamine, or methylphenidate. So the brand names you may be familiar with are Adderall or Concerta or Ritalin. It seems counterintuitive that a stimulant would help to calm someone down, but what it actually does is increase your brain's ability to focus and to increase the function of the frontal lobe, which increases your impulse control as well. Now, if those medications alone are not working for a patient, then we do sometimes use other behavioral meds, psych meds, or sometimes sedatives as well. So we are starting to see new medications like guanfacine. Let me spell that for you. Or atomoxetine. And these work more like anxiety meds or depression meds, where they're actually changing the chemical balance in the brain. So we'll see these usually as an adjunct where they're working with the stimulant, although in some patients we do see them alone. Finally, we do sometimes see clonidine. In higher doses, it can actually be used as a blood pressure medication for adults. In ADHD, what we're actually using it for is a mild sedative for bedtime. If the stimulants are making it hard for the child to sleep, then the clonidine can help. Speaking of difficulty sleeping, we do need to be aware of the side effects of these medications. An important side effect with the stimulants especially is lack of appetite. So in this time when our children are supposed to be growing and getting stronger and bigger, if they're not eating anything, we really can have a failure to thrive picture. There's also a small chance of cardiovascular complications or even compulsive behaviors, anxiety, so we do need to be aware of that as well. Many psychiatrists advise taking some kind of medication vacation on a regular basis to ensure that the medication really is helping the child and to ensure that the side effects are obvious. So many children will take the summer off just so that the parents can actually see how the child does without the medications to evaluate whether they're really necessary and to allow that child to have at least a few months of the year where they really are growing and developing naturally. What we don't recommend is taking weekends or short breaks off because it does take several weeks for the body to sort of adjust to the medication. Although we do have college students who will choose to only take their medication, say during finals week or during midterms week, because that really is the only time of year that they feel they require the help of the medication. Okay, last thing for today, we're going to talk about psychosocial development for the school-age kids. So this is still Erickson. And in this case, his stage is industry versus inferiority. So remember with our preschoolers, this was initiative, now this is industry. So we really do see that the children are completing tasks and mastering skills, not just starting things, but actually finishing them and doing them well. So if you think of your elementary school students who are usually doing a lot of book reports and worksheets and small manageable tasks, but they do take a lot of pleasure in completing those tasks. What we need to be aware of is that they do need to achieve that task well. So for teachers and parents, it's important to assign tasks that are doable, achievable for that child, rather than setting impossible goals. The other thing under psychosocial we've always discussed is play. In this case, we have finally made it to cooperative play, where the children are able to work together to accomplish a mutual goal. So if we're thinking about that soccer team again, they're finally learning the art of passing and different people playing different positions. So they're learning to work together as a team instead of just going only for their own personal interests. Rules also become really important here. Being aware of the rules and following the rules, whether it's in a play situation or in school or even at home, gives the children a sense of security and a sense of belonging. The last important thing here is friends. So this is the age where many children start to talk about who their best friend is. And they talk about having sleepovers, and birthday parties become very important. This is also where exclusions and bullying start to show up. So some exclusions are fairly harmless. For example, a group of girls may decide that they're going to have a girls' club and that there are no boys allowed. This is pretty developmentally typical as the children learn to sort and classify. They'll also try to sort and classify each other and their peers. Where this becomes really damaging is if we have a few or even a single peer in a class or in the neighborhood who is neglected or rejected by all the other children. So we have neglected peers, and we have rejected peers. So the neglected peer is the one who sort of sits in the corner and no one even really knows they exist. The rejected peer is the one who people make fun of, tease, actively attack. So both of them are very damaging to that child's social development, but they are this one is more passive and this one is more aggressive. And then of course we do have bullying as well. So bullying is systematic, repeated, intentional attacks against another person, whether it's verbal bullying, physical bullying, emotional, social. We know that bullies are actually very socially intelligent. They know exactly how to hurt another person, but they seem to lack compassion. So they actually find pleasure in inflicting that pain rather than feeling sorry for inflicting pain like most people. In recent years, many schools have instituted policies and programs to really try to clamp down on bullying. So we're seeing peer programs where there are peer advocates assigned in each class who watch out for bullying and address it when they see it. Teachers and staff are also receiving additional training about how to prevent or address bullying. And finally, school-wide programs where every student is educated about the harms of bullying and how to address it if they do see it. Some of you, when you were growing up in school, bullying may have been an accepted part of childhood, but that's no longer true. We know the damage it can do, and especially with all of the Snapchat and Facebook and Instagram, there's a lot of cyberbullying happening as well, and we know how damaging it really can be to a child's mental health.